Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of multiple sclerosis. So, in the clinical features of multiple sclerosis, multiple sclerosis mainly occurs due to the weakness of the limb. In the multiple sclerosis, the patient presents has weakness in the limbs. Because of the weakness in the limbs, the patient will have fatigue and he will also have gait disturbances are also common in multiple sclerosis. In multiple sclerosis, many pyramidal signs are seen in multiple sclerosis like increased tone and hyperreflexia. All the reflexes were found to be exaggerated, with extensor plantar reflex or Blabinski reflex being positive is seen. Deep tendon reflexes may be lost also. Then, in multiple sclerosis, most important is the ocular manifestations, that is optic neuritis. Optic neuritis are usually present, and this optic neuritis is present mainly in one eye, monoocular, and even periorbital inflammation is also associated with multiple sclerosis. Here, along with optic sclerosis, the patient will have decreased acuity, visual acuity is decreased, the patient can have papillitis, and also optic atrophy can also be seen in the patients with multiple sclerosis. Then then we also have sensory symptoms can also be seen in the patient with multiple sclerosis, like the patient can have paresthesias with numbness. Then these patients can also have impotency is seen, but it is not seen in early stages, it is actually seen in late feature. Then ataxia can be seen mainly due to the cerebellar involvement will result in ataxia. Then the patient can have bladder dysfunction is seen in the patient. This bladder dysfunction is seen in almost 90% of patients with multiple sclerosis. Bladder dysfunction can be either the patient can have atonic bladder, or there can be urgency in the bladder, or there can be hesitancy in the bladder, or there can be incontinence can be seen in bladder dysfunction. Then cognitive dysfunction is also common in patient with multiple sclerosis, where there is difficulty in or memory loss is present in the patient, and impaired or difficulty in concentration is also seen, and attention deficits are also seen in patients with multiple sclerosis. Then almost 60% of patients with multiple sclerosis will suffer from 60% of the patients with multiple sclerosis will suffer from psychological symptoms like depression. And in the multiple sclerosis, suicidal tendencies are also more in multiple sclerosis patients. Then in the multiple sclerosis, we have two named issues which are called as Uruthox phenomenon. This Uruthox phenomenon is actually a heat sensitivity. It is a heat sensitivity issue where the patient will have new symptoms, or there can be worsening of the pre-existing symptoms may occur, and these uh, new symptoms or worsening of pre-existing symptoms are mainly present on exposure to heat. Whenever the patient is exposed to heat, the patient might have new symptoms, or worsening of pre-existing symptoms may be seen in the patient. Then the next type is we have Lermet symptoms are seen in the patient. In Lermet symptoms, this is also called as Barber chair sign. In Lermet symptoms or Barber chair sign, the patient will develop an ectopic impulse is developed. Ectopic impulse is developed along a nerve root. Okay, so that is Lermet's sign or Lermet's symptoms. And the patient can also have paroxysmal symptoms are also common in patient with multiple sclerosis, like the patient can have tonic spasms, or dysarthria may be seen in the patient with ataxia, or diplopia is seen in the patient with paresthesias, and even pain sensation is also seen in these patients. These patients can also have trigeminal neuralgia can occur, with facial myokymia can be seen, and even vertigo is seen in the patient with multiple sclerosis. One more important thing is internuclear ophthalmoplegia is one of the important feature of multiple sclerosis. Then
Thank you and thank you for watching.